Happy Friday, everyone. You're watching Moms Matter. I'm your host, Srin Yagar, and joining us in the studio today is Dr. Adrianine, who is a triple board certified physician. She has done an incredible TED Talks, and she's here today to talk to us about her book and how we can really talk about hunger in a different way. Thank you for joining us.
I'm so excited to be here.
I'm just so excited to have you. You are so brilliant. You've done so much great work, and I feel so honored that you wrote an article for LA Mom magazine, and in that article, you talk about how we all set these goals for the new year, right? To lose weight. And by the time we hit this time in January, we've already lost all of our commitments. Why does that happen?
Yeah, I have this interesting relationship with the new year because I love the idea of a fresh start. I love the idea of a new beginning. But I also think that so much of the pressure that we put on ourselves for the new year and the intention setting can be so lofty that it's hard to achieve. And we need little wins in order to stay in the game, right?
Right.
We need to succeed in order to stay in the game. And so while it may not be as exciting to shoot for small little wins, it is a way to, over time, build up to something substantive.
Okay. So rather than saying, okay, my New Year's goal is I'm going to lose 20 pounds by, Valentine's Day, set smaller achievable goals so that you don't lose everything, so you gain momentum.
You know, I talk about this actually in one of the chapters of the book in terms of like managing our expectations, right? So I had a patient who came in and was losing 2 pounds per week for the first month. Super frustrated and told me basically I could be doing anything. I don't have to be coming into an office. I don't have to be seeing a physician in order to lose 2 pounds per week. Reassured her. She came back the next week, still frustrated. By week 6, she was gone. A year later, she came back. Not only was she unable to maintain that 2 pounds per week, but she had gained weight in the interim. And this is what happens when we can't manage our expectations appropriately. Now let's look at what happens if we were to lose 2 pounds per week. 8 pounds a month, 24 pounds in 3 months, 50 pounds in half a year. I mean, that's substantial, right?
Right. You talk about something so interesting in your book, and you talk about this in your TED Talks as well, this theory, and I thought it was really revolutionary. You talk about how our hunger and how we'll go in, and we all do this, right? We're like, we'll go and we'll savage the ice cream and the chocolates, and that hunger isn't because we're really hungry, it's because of an emotional reason. Can you talk a little bit about that?
Yeah, I love talking about hunger in terms of spiritual hunger, emotional hunger, and actually, even though it's my professional work, getting away from the food and getting away from this notion of weight. When we talk about emotional and spiritual hungers, we make that concept so much more accessible because we all hunger for something or things, right? We have basic needs that are ingrained in our culture, ingrained in our society, ingrained in our DNA, right? Things like belonging and connection and purpose and meaning. And when these desires, or actually needs, are not met, they manifest as a hunger that we then soothe, maybe with food, but maybe with alcohol, maybe with overworking, maybe with distracting in another way. And so when we talk about hunger in terms of this emotional or spiritual need, it dissociates the notion of food, which carries so much shame and then takes us down a rabbit hole that is not very productive, right? And talks about it in a more universal sense. And I'll tell you, I've been doing this work for almost 20 years, seeing patients in the office. And I've met with CEOs and stay-at-home moms and producers and actors and, I mean, really every type of person of all walks of life. And I'll tell you that nobody is immune from these hungers, right? And so my goal in talking about it this way in the book, and as you know, the book is very personal, intentionally so, is because I want to take away the shame around these emotional and spiritual hungers. I want people to lift the veil behind their own emotional and spiritual hungers, because if we can meet them in the right way, then actually it's such an incredible opportunity to gain insight into what it is that you truly are hungry for. What are you yearning for?
I mean, it's so brilliant, the notion of it. And it's so true when you really think about it, right? Like, why are you going to eat that bag of chips? And why do you keep eating it? You're not hungry. Your stomach isn't growling, but it's like you want to be seen, you want to be heard. You're just going, 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 and it's empty. And I see it with my like teenagers, right? I'll see them do it. And I have a really hard time because I can't say like, why are you doing that? But maybe we should be. I mean, how do we handle this? How do we even begin to unravel this hunger?
So it really isn't, there isn't a bite-sized answer. I think a lot of times when it comes to talking about this concept, particularly when it comes to weight loss, people want the 5 steps to X. But when we're talking about something that is emotional, when we're talking about something that is spiritual, there are always layers. And these layers take time to unfold. And of course, once one layer has been passed, there's another one underneath. And so it really is a process in which people need to be open and amenable to the long haul. But where it starts is with awareness, because there's a trigger, right?
Right, right.
And usually when we experience a trigger or a craving, if we're talking about food, the reaction is immediately behind it, right? There is no pause, there is no space. And in my mind, when I think of triggers or when I think of cravings, I envision like a rubber band that's kind of stretched out all the way, right? And then that thing, you let it go and it snaps. And that's also physiologic. So if we feel a craving or a desire for something, it revs up our nervous system. You feel that sense of angst in your gut, in your heart, right? But if we can slow that space down in between the trigger and the reaction, then you give yourself an opportunity to be like, maybe I'm not hungry. Or maybe I don't really want that second glass of wine. Or maybe I shouldn't pick up my phone and start scrolling. Like, what is actually going on here? And in those moments, again, it's uncomfortable. But if we can be with that discomfort, there is so much beauty that can unfold. Because you are giving yourself the opportunity to acknowledge a need and then to reckon with it.
That is so beautiful. It's starting with mindfulness and really being in tune with yourself.
Correct.
And not being reactive and pausing. And that does take a lot of work. It's not easy because it's not taking a diet pill to control some, right? It's not a Band-Aid. You're really doing the work and digging in. But you're absolutely right. And your book really helps walk you through the process of how to really tap into yourself and how to be more mindful. And I feel like if we can do this for ourselves and show by example to our children, we can save them a lot of angst down the road, down the road, because it's huge.
Absolutely. And when it comes to children, because this question comes up a lot, and again, we can talk about food, but I really want to step away from that and talk about it globally.
Yes.
You're a mother, I'm a mother. How do we teach our children to deal with tumultuous times? How do we teach them to have self-regulation, to regulate their emotions? You know that if you give them guidance or advice, it's usually not the right strategy, right? They shut off immediately.
True.
So it really is through role modeling, and to be able to do that for yourself and to be able to show that through these tools and skills, you are less reactive in your relationship with them, in your relationship with your partner. That is such an effective way to relay that information. And I have found personally that there really is this beautiful ripple effect that occurs when you do these things for yourself.
So true.
Right?
So true. Because when you're really showing your authentic, not preaching and doing and showing, then your children will see and they will hopefully do. Now, Dr. Eugene, you've done so much work on yourself, spiritually, mindfully. You live your life. You're a very authentic person, and I love that about you, which is why I brought you on today. You speak truth. Tell me how you pause so that you're not reactive. I mean, give us one of your tips, because we can talk about it, but how do we actually implement it, right? In that moment, we're triggered and we want to just go for it. How do we hold ourselves back?
I mean, first I want to say that even for me, who does all the things, and there are a lot of things that I do that I'll share, it is this onion that there are layers. And something that I actually have found in the last few months and following October 7th and all of this feeling of reactivity that I have experienced, in my ability to be with that discomfort and less reactive. However, it took 2 months of being very reactive before I got to that point. And the reason why I bring this up is because even if you know the things, even if you do the things, the expectation cannot be that you're always contained.
Correct.
Right?
Correct.
This is a process. But okay, the things that I do, for me, movement is essential to my life. And the funny thing is that, and I share this also in the book, that back in the day, when I was in high school, when I was chubby, when we had to run the mile for, the high school thing that we all had to do, I hated it. I absolutely hated it. And to me, exercise or movement was equivalent to weight loss, which actually is scientifically false. That's another, I digress. And so it was wrought with so much emotion doing that work. And also it's uncomfortable to do, especially vigorous activity. You sweat, you huff and puff, your legs are rubbing against each other, right?
Sure.
I mean, this is true.
Sure.
But the studies show that when you engage in regular movement, there are so many benefits. But this in particular, I love, because that vigorous intensity, that same exercise that makes you uncomfortable, makes you better able to tolerate psychological discomfort as well. So it's not only the endorphins that you get, it's not only the gasket valve that gets released. And a lot of times my husband will tell me, can you go for a run and then we'll have this conversation?
I love that.
Because I really come back like I've solved all the problems. I'm like, oh,
Zen.
I'm
yes.
zen.
Yes.
So not only do you get that immediate sense of, like you've worked out your distress, there is this lasting phenomena of being able to tolerate physical distress or angst makes you better capable of tolerating psychological distress. When I say this, people are always like, oh, I'm not one of those people who loves exercise. Guess what? I wasn't either. It's not that you do what you love, you end up loving what you do. And now I'm at the point that if I don't exercise, I am a basket case.
100% agree with you.
Right? Which is why
100%.
my husband says, please go for a run,
Yes.
and then we'll have a conversation.
Yes.
So that's one thing that I do regularly. And the other thing I'll tell you that I do regularly, and I've done since I was 6 years old, is writing in a journal. And so I I was born in Southern California. I left Southern California and moved to Dallas back in the 80s. If you think Texas is tough now, imagine a brown child in Texas in the 80s. And we moved mid-year, and it was just, not only did I look different, my parents had also lied, so I was 2 years younger than everybody else, that to advance me in school. All the cards were stacked against me. And Miss Lusky, this wonderful teacher in 3rd grade, gave me a spiral notebook my first week there. She could tell that I was having trouble. And she basically asked me to promise that I would write in this spiral notebook every day. And I want to tell you that every day, almost, with the exception of a few nights in residency, I have a little thing at my bedside and I write. And again, I love when the science supports the experience, because the data has shown that when you journal regularly, it's associated with reduced ruminations, reduced anxiety, depression, and then crazy things like people with rheumatoid arthritis who journal have reduced disease score. They take less NSAIDs or Advil or anti-inflammatories.
Wow.
Asthmatics who journal exhibit bigger functional volume in their lungs. These are very concrete, tangible benefits, right? So I start my day with exercise. I close out my day with some form of writing.
and any form of writing. It can be gratitude, it could be about your day, it's just whatever you want to write about.
Yeah, absolutely. I mean, I like the idea at the end of the day of like a blah journal,
Let it out.
right?
Right.
Because a lot of times we are so busy during the day that we don't process until night, and then that leads to ruminations, which then leads to insomnia, which has its own issues. So giving yourself 10, 15, 20 minutes to just say, okay, now is your time to really clear out your mind 100%. And then the contract you make with yourself is, okay, once that timer goes off or that time goes off and you close the book, it's there for safekeeping, but then you really discipline yourself to not go back into ruminations at night. And, you know, insomnia is also a major thing. 30+% of Americans report insomnia. This was before COVID. It's, I'm sure, more
Much
now.
worse, right?
And that results in metabolic issues. So these tools, and we don't talk about it as physicians, you know,
No.
we don't talk about mind-body tools, but they are so critical, not only to our emotional health and well-being, but also to our physical health and well-being.
I mean, I can just imagine how much better our relationships will be with one another if we can just do those two things, work out and journal, so that you're less reactive in the way that you talk to your partners, to your children, to your coworkers, right?
Absolutely.
It just brings you in a different space.
Absolutely. And when I talk about that pause between the trigger and the reaction, it doesn't manifest by itself in that moment.
Right.
We can't expect for ourselves to kind of reel it in once, you know, the train is out of the, where is the train out of? It's not the barn, that's the cow.
No.
But you know what I mean. So when we do these practices, whether it's exercise or movement, whether it's journaling, whether it's breathing, meditation, you're kind of cultivating that ability to bring pause into those moments and as a cultivation, not as a, you know, on the spot expectation. And that's what the process is about, right? It takes time.
Right. And I love that. And it's just about being kind to yourself, making space for yourself. So yes, I do the workout, but now I'm going to start the journaling in the evening because I don't do that. And it's
You're
just
gonna
about
love it.
giving yourself permission to have time for yourself, to do things that serve you. And those I can so see myself not going for those bag of chips because I'm taking care of my mind and my body, right? In that way of caring for yourself. Now I'm going to shift for the last part of our segment, because there is the true fact too that tap into mind body so you're living, right? Your life is really not consumed by food. But what if you've got a wedding, you're going to be in a bikini, you've got to just lose that weight quickly, you want to look good, you put on a few pounds from the holidays. What do we do?
So it really is all about the food. I mean, exercise is very important, and exercise is important in terms of weight maintenance and in terms of so many other health benefits. Right. But a lot of times people get frustrated or disappointed because they start with a trainer, they start a workout, and then they don't see the results. It really is 95% what you consume. I'm a big fan of protein, not because I promote keto diet or Atkins or anything like that. But protein is like your endogenous or your body's own Ozempic. It is the macronutrient that is most satiating. So eat it, and eat it in abundance. Another thing I like to talk about is the mindset shift around it. Because when we think about food in terms of restriction, right?
Yes.
What happens when you tell that baby not to stick their finger in the socket? It is their life's mission.
That's right.
Right?
That's right.
So let's not think about food in terms of restriction, and actually we don't have to. Think about it in abundance. Eat so much of what serves you so that there's less room, less desire for that which is not. So protein in every meal, and usually the number is around 20 to 30 grams. After that, I say, okay, double up your veggies. So I don't portion control in terms of telling people, eat like a piece of chicken in the palm of your hand. First of all, whose palm are we talking about? Because I have a really
I love that. Thank you.
I have a small palm, and like, this is not going to cut it, sister. Right? So nobody gained weight from too much chicken. Eat as much as you want, but then you double that in your vegetables.
Okay.
And then last but not least, let's stop vilifying carbs, because not all carbs are the same. First of all, vegetables are carbs, but let's put them aside.
Okay.
Beans are carbs, asparagus are carbs, and Pop-Tarts are carbs, right? They are not the same. And actually eating more or consuming more beans, grains, legumes, they're high in fiber. They also have protein in terms of beans and legumes. And there are all these other benefits. So I love 2-fers and 3-fers, right? So eat something, it helps you lose weight, but then it also helps your heart and helps your brain. Then, you know, it's a win-win.
Love it.
So protein with every meal, double your veggies, and bring in the good carbs for fiber and, you know, that energy, sustained energy that keeps you satiated longer.
And if you can stick to that, you'll shed your weight quickly if it's for a purpose, right? If it's for something that you're leaning for a quick fix, that's your quick fix.
Yeah, it is. And I don't say, you know, like people always ask, where is pasta in that? Where is, you know, if you're thinking about food in terms of sustenance and nutrients, that's different than entertainment. I go out with my husband once a week. We go out on date night. That's entertainment. I may have my glass of wine. I might have French fries, pasta. But in my day-to-day, if I know I'm going to work and I need to be on, my brain needs to be on, that food is not substantive. And so again, if we shift our focus of how is this nourishing me?
Correct.
It's not about weight and dieting. It's about you want food that's sustaining you, right? Mind and body. And that's a whole different way of thinking about food.
I love it. So you eat everything. There is nothing you don't eat. Is there anything you won't eat because it's just so terrible for you? I mean, you're a triple board certified physician. You know it all.
I mean, you want to know a secret?
Yeah.
It's not a secret because, well, it's not going to be a secret anymore. I have an obsession with sour gummy. Sometimes I say sour gummy worms, but the truth is I don't discriminate.
Anything the sour.
There's, you know, bears, worms. My daughter brought me llamas. Like there are sour gummy. Love it. So
we have something in common now.
Yeah. I really don't. I mean, I really don't. But I really ask myself, I do this. I ask myself, what do you really need right now? What do you want right now? And if the answer is that I have pent up nervous energy, even if I really don't feel like lacing up my tennis shoes and I just want to go into the pantry, I tell myself, you know what? That sour gummy worm in that moment, when it's being used to soothe a different hunger, it doesn't even scratch the itch, right? So eat that sour gummy worm because you're really wanting it. Eat that decadent food because you really are desirous of it, not because you are trying to gloss over something else, because that thing, that itch, that hunger is still going to be there.
Oh, I love that. I love that. Everything you said is just amazing. Thank you so much for sharing this all with us. And for people who want a copy of your book, where do we find it?
It's on Amazon, it's on Audibles, it's on my website, dradrianneedham.com, with a lot of other goodies. So.
Love it, love it. Thank you for all that you're doing. Thank you for sharing your time with us and your expertise. You are a superstar, and you saw it all here on Moms Matter, and we hope to see you all next time.